Hello, my name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. We are the largest Medicaid providing clinic system in Louisiana, and I'm also the co-chair of the ACOI Infectious Diseases Subspecialty Section. Along with the leadership of the ACOI, we want to thank you for all that you're doing as we face this unprecedented time in medicine fighting the SARS-CoV-2 virus. Moving forward, in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some of the bright spots that we are seeing so that we can all feel some hope in these trying times. So in terms of the news, what we're seeing is that healthcare workers are being disproportionately affected by the SARS-CoV-2 virus. So I want to start by saying that as healthcare professionals, we are often focusing on trends and data as it relates to caring for our patients' health. And this makes sense. This is our job. But like most things with this pandemic, it's hard to ignore some notable and often startling information as it is coming in and continually changing. One of those things that the CDC is essentially monitoring in terms of the SARS-CoV-2 transmission as it relates to our healthcare workers. And the fact that is becoming more clear every day is that our healthcare workers are, not surprisingly, at immense risk during this time. And the numbers, unfortunately, are bearing witness to that. And the fact is that healthcare workers are a disproportionate number of victims to COVID-19. As medical providers, we face the highest probability of contracting the virus since we are being exposed more often. And as I was explaining to somebody just actually earlier today, the PPE is not 100% foolproof, and there's times when human error and breaches will occur when using PPE. It's also a reminder that we are human after all and not machines. So here are the numbers from the CDC as of April 9th. At least 27 healthcare personnel have died from COVID-19 here in the United States, and as expected, the vast majority were exposed on the job, and there's also suspicion that this number is largely an underestimation. So look, I'm going to sound like a broken record here, but again, mass social distancing is critical, and these efforts directly affect our chances of staying well and keeping each other and all of us in the medical community safer. And again, lastly, I cannot thank you enough for the heroic work and leadership that you all have demonstrated from the front lines. So, in terms of a clinical update, this one comes to us from the Infectious Diseases Society of America that I'm going to refer to now as the IDSA. That is one of our guiding societies in infectious diseases. So many pharmacological therapies are being used or considered for the treatment of patients with COVID-19. Given the rapidly emerging literature on treatment, the IDSA has convened a panel to develop interim evidence-based guidelines to support clinicians in making decisions about treatment and management of patients. And you can find those recommendations if you search for IDSA and COVID-19 and guidelines. And I'd give you the web link, but it is long, and I figured IDSA and COVID-19 and guidelines are going to be easier to remember. Also of note, these guidelines are actually a living document that represents the best understanding to date on the treatment of patients with COVID-19, but it will be updated frequently as new information becomes available. This document is essentially in 3 sections: treatment and management, infection prevention, and diagnostics. So the first section, treatment and management, was just published, and I'm going to now give you their recommendations. Number 1, among patients who have been admitted to the hospital with COVID-19, the IDSA guideline panel recommends that hydroxychloroquine or chloroquine should only be used in the context of clinical trial. Recommendation 2, among patients who have been admitted to the hospital with COVID-19, the IDSA guideline panel recommends hydroxychloroquine or chloroquine with the addition of azithromycin only be used in the context of a clinical trial. Recommendation number 3, among patients who have been admitted to the hospital with COVID-19, the IDSA guideline panel recommends the combination of lopinavir, ritonavir only in the context of a clinical trial. Recommendation number 4, among patients who have been admitted to the hospital with COVID-19 pneumonia, the IDSA guideline panel suggests against the use of corticosteroids, and this is a conditional recommendation with very low certainty of evidence. Recommendation number 5, among patients who've been admitted to the hospital with ARDS due to COVID-19, the IDSA guideline panel recommends the use of corticosteroids in the context of a clinical trial. Recommendation number 6, among patients who have been admitted to the hospital with COVID-19, the IDSA guideline panel recommends tocilizumab only in the context of a clinical trial. And lastly, recommendation number 7, among patients who have been admitted to the hospital with COVID-19, the IDSA guideline panel recommends COVID-19 convalescent plasma only in the context of a clinical trial. So as you will note, there is no evidence to recommend any particular medication for the treatment of COVID-19. The expert panel of the IDSA has pretty much concluded, but remember to check back often, as this is a living document, so it will be updated regularly as clinical trials are concluded. And for our last section of the night, the good news section, we're going to talk a little bit about reopening the country with some thought. So I want to close about talking about forward thinking. That is coming from the West Coast, and that is California Governor Newsom came out this week with 6 common sense principles as part of his plan to reopen the state of California. Governor Newsom says his team is working with governors of Oregon and Washington on plans for the incremental release of the stay-at-home orders. And these plans will rely on science and look at 6 areas to determine when and how to start reopening the state's economy. And I think he's got it right, so I'm going to reiterate those principles here. 1, expand testing. 2, protect high-risk groups, including seniors, the medically vulnerable, and people in facilities like nursing homes. 3, ensure hospitals have enough beds and supplies to care for patients. 4, continue with progress in developing treatments. 5, ability of schools and businesses to support physical distancing. And lastly, the ability to decide when to reinstitute stay-at-home orders if needed. The plan on how we open up a country, our country, must be done carefully, especially in light of how we are seeing China and Hong Kong reopen. And when they are, unfortunately, they're starting to see COVID cases resume. And to be honest, I anticipate that we will see the same here. So I believe that pulling the plug too early will put lives at risk and the economy even further at risk. When I responded to the Ebola epidemic 5 years ago as part of managing the Ebola outbreak, we used a test, treat, and isolate method to get a handle on the situation once the cases came down to a manageable level. Test, trace, isolate. So we tested for people who were positive and conducted contact tracing to find people who were positive and to find and we used contact tracing to find the people that they had previously been with. And we isolated those people who we were testing positive. And that's what we're going to need to do here in the US. And I wouldn't be surprised if we see states start to hire some of their out-of-work individuals to help with this effort, because it's going to be significant to do all this contact tracing. I do want to end, though, by going back to California and how they're handling it. They've kept their COVID numbers relatively low, and this is in a state with the highest population in the country, nearly 40 million people. Yet they have a relatively low number of hospitalizations and deaths, and as of Wednesday, 5,665 patients were hospitalized and about 1,500 were in intensive care. Overall, more than 23,000 people have tested positive and only 760 have died. The governor's early orders to shut down the state, which was the first in the country to do so, has proven to be a good strategy, and now going forward as a country, when the time comes, we need to follow suit and be just as strategic in how we reopen the country. So in conclusion, please stay on the lookout for these regular updates, and to read more from the sources used in this report, go to acoi.org/COVID-19. And together with the ACOI, we will help you with the latest information to help you respond with your patients and to stay on top of the crisis. Also, please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.